Hello, I am your host, Diona and Dr Priya, and this is the V Revolution podcast, brought to you by women's intimate health brand, Balance Active. Today we're going to be decoding some of the weird, wacky and wonderful things about the female body and mind.
Hi, I'm Dr Priya, and today we are deep diving into those intimate health conversations because let's be real ladies, we're all in this together. If you have any concerns, then please don't hesitate to see your GP.
So let's revolutionise how we talk about women's intimate health. Today we're going to be shining a spotlight on the most common intimate health issues. Stuff like BV and thrush and that old question, why does down there smell so fishy all of a sudden? And I'm joined by the brilliant Dr Priya, who will hopefully be answering some of our questions today. Hi, Priya.
Hello, Diona.
Oh, still passive aggressive. Are you well?
I'm very well, how are you?
Tell me a wee bit about how you came to be the brilliant doctor that you are. What was your journey like? Why medicine?
So I guess it started when I was at school, like 10 years ago. I did some work experience in an A&E department. I loved just like the rush of it. I loved seeing all the different cases, how just as a person, you know, the doctors, they could, you know, do something so small that it would make such a big impact. And I thought, well, yeah,
you did your work experience when you were in secondary school in A&E.
In A&E, yeah.
I didn't know you could
I think
do
I was like 16 or 17. Yeah, I knew that I wanted to do some sort of science thing.
Yeah.
And I went into a research lab, kind of found it a bit boring.
Yeah.
And then went to A&E and
because A&E is so fast paced, like it's constant. Did you ever feel like I am really in the road, or were you like hands on and able to be quite practical and helpful?
Yeah, I absolutely loved it. I thought, you know, I loved running around the hospital. I love running outside the hospital too.
If anyone who doesn't know, Priya runs ultra marathons. She's not just running around the hospital for no reason.
Yeah, I just loved the environment, and I think it's just such a privilege that doctors have to be able to make such a big impact on a patient's life, that I thought,
that's for me.
Yeah.
And obviously it's like such a long time to train to be a doctor. That is such a long time, and then obviously you go into like specialise and stuff. How long is medical school?
So medical school is 5 to 6 years.
Yeah.
And then you start your specialist training. You do 2 years, sort of rotating around specialities, and then you start your specialist training. So that can be like 5 years. So if you want to go into surgery, it can be 5 years. If you want to minimum.
And what are you doing? What do you want?
So I think I want to go into surgery.
Yeah.
I'm not sure what kind. But yeah, I've still got time to decide.
I could not imagine like doing surgery. Like I feel like that's crazy. Like having the confidence. I mean, it's obviously so necessary. We need surgeons, but it's like such a big thing to take on, isn't it? Like it's such a huge thing.
I guess there aren't enough women in surgery.
Yeah.
The training for surgeons in the UK isn't really conducive to women sort of having children and that kind of stuff. But I want to prove that, you know, you can do it all.
Yeah. I didn't realise there weren't that many female surgeons.
In comparison to male surgeons, not many at all.
Wow. Yeah. And I suppose obviously it's great to have as many female like healthcare providers and doctors and surgeons as possible, because I mean, realistically, a lot of us feel more comfortable like talking about our especially intimate health issues with a female. Like that usually is just the case, you know, sadly so. I mean, but that is the case. So it would be great to have more women in the field of surgery as well. So a lot of the things that we are going to cover today are the most common intimate health issues, things that most people will either experience once, if not multiple times in their life, or someone that they know will have experienced them. Some more serious than others. Some can be like everyday things. First of all, I'd like to talk about BV, which is, if I am correct, bacterial vaginosis.
Yes, you said that perfectly, Diona.
Don't patronise me. It's like I'm a toddler and you're like, well done. No, thank you, I worked very hard.
I'm sure you know a lot more about it than you think you do.
I don't know, this is the thing. I honestly only heard about it recently.
Okay.
I never heard of it before. But I think that's the thing, because a lot of people confuse bacterial vaginosis with thrush, if I'm right. So let's start at the start. What is bacterial vaginosis?
So it is a condition where there's a change in the natural balance of the vaginal pH.
Right.
And this can cause a discharge, which is, it tends to smell a bit fishy. It shouldn't be sore or itchy, but it can sometimes change the colour of your vaginal discharge, make it a bit greyer, a bit thinner, a bit more watery. And this is due to this change in the pH of the vagina.
And what causes a change in the pH in your vagina?
So it can happen for a huge range of different reasons. If you're sexually active, that puts you more at risk of it. Having multiple sexual partners, having an IUD can also increase the risk of this. If you use products to clean your vagina if you douche, as they call it.
Soap of any kind.
Soap of any kind, any perfume products. And those are the main things.
And why do we need to keep our vagina at a specific pH level? Why is that important?
So there's this thing called the vaginal microbiome. Don't know if you've heard about it.
Nope.
But it's just essentially this environment of lots of different microbes, so bacteria, fungi, lots of different things, and they work best when your vagina is between the pH of 3.8 to 4.5, and it's almost a defense system. To prevent bacteria from coming in, to prevent obviously it's got bacteria in it, but it's just this micro environment of defense. And so when you try to change that, it can result in thrush and BV.
And so with BV, so you say it shouldn't be itchy, it shouldn't be painful, and the main symptom that you would see is a more watery grey coloured discharge that smells.
A bit fishy.
So how can someone treat BV?
So there are over-the-counter stuff, like the BV treatment that Balance Active do, and they do a gel or a pessary.
So this is the treatment gel and this is the pessary?
Yes, exactly.
And you can get those over the counter?
Exactly. And then you can also get antibiotics on prescription from your GP or local sexual health clinic.
And if it's something that's reoccurring, is that something that is alarming, or is it common for someone to have reoccurring BV?
So it is common. I know that if it comes back, more than 3 or 4 times a year, you should definitely seek help from your local sexual health clinic or GP. But sometimes it can be symptomless. So you may have BV and you may not have any symptoms. It's one of the most common sexual health conditions.
BV is?
Yeah.
Is it?
And BV is one of the most common intimate health conditions. And a lot of women have it that don't know about it. It's very, very common to have.
But that's the thing, because I hadn't even heard of BV, if I'm being perfectly honest, but I've heard loads about thrush. Thrush is the one that you hear all the time. It's like BV is thrush is just forgotten cousin. People don't talk about it as much, therefore to know how to treat it is probably just something that's less commonly known. Exactly. And what is the difference between BV and thrush then? Because thrush to me is something that people talk about when they feel uncomfortable and feel itchy, and it's not just that change in discharge.
So thrush is a yeast infection caused by the Candida variety of yeast, and it usually lives sort of harmlessly in the vagina, but in the same way as BV, it can be caused by a disruption to that microbiome, so can thrush. And so they are caused by a similar sort of mechanism, but thrush is due to the yeast. And so it is, in terms of the discharge, thrush has more of a cottage cheese-like discharge. So if you think of BV, it was quite, greyish and watery and smells a bit like fishy. Whereas with thrush, it doesn't really smell very much, but it looks thick, like cottage cheese, exactly, thick, creamy. And it can be accompanied by a bit of soreness, a bit of itchiness. sometimes a bit red.
Discharge seems to be one of the main things that we just get the ick with. Like, we don't want to talk about it, but like every single one of us, every single person who has a vagina has discharge in their underwear. But yeah, we act as if it's like just I, you know, and like we don't want to talk about it. And why do you think that is?
I honestly don't know. I think the word, I know, even when I say the word discharge, it's kind of like, well,
it's the word.
It's the word discharge.
If we change the word, would it help? I don't know.
Honestly, women have a teaspoon of discharge on average every day. You know, when we go to the bathroom, we look at our underwear, there is discharge there most of the time.
Yeah.
So I don't know why we have
why we don't really like to talk about it. And even like men, if you mentioned the word discharge, I think immediately they're like they don't. It's like they feel.
I feel like men don't even know that women have discharge, and this happens. Vaginal discharge is normal.
Yeah.
You know, we get it as part of our menstrual cycle. It changes as well, so it's not the same every day.
Yeah.
During ovulation, it's thinner and wetter and clear, and then after that, because of the increase in progesterone, after ovulation, it becomes a bit thicker and whiter.
Yeah.
And so it changes throughout the cycle. You know, sometimes you may get more discharge, sometimes less. It's all based on your hormones.
And there's a discharge checker about the Balance Active Have, isn't that right?
Yes.
You can sort of check to see the colour and the consistency and have a look and see if everything is as it should be, or if you should be seeking some sort of help. Yeah,
it's also a good way just to track your cycle.
Yeah. You had said to me earlier today that you had something to say about discharge.
Oh God!
Do you feel like you want to share it?
No. So you were talking about, Diona, you were talking about how men don't know very much about discharge.
Yeah.
So it's an intimate story. So I won't give you all the ins and outs of it. But I had an ex-partner who he didn't realise that women had discharge, and so during intercourse, he was shocked at the colour of my discharge. And I mean, it was very normal. It was a normal discharge for that time of the month. And he was just alarmed. He was sick. I'm not going to tell you what he thought. That honestly, it was wild. But I just
were you like, let's get on the internet to show you a few pictures?
I did.
Oh, did you?
I did. I went onto the internet and I was like, look, this is leukorrhea. This is normal discharge. That's the scientific name for discharge.
Yeah.
So it is normal.
You're like, let's talk sexy.
Exactly.
This is leukorrhea.
Yeah, exactly. But yeah, definitely. It was.
I suppose they don't
moment.
see it that often, and like it's usually on your underwear. They're not really paying attention to your underwear when it's off.
Exactly.
Do you know what I mean? So why would they see it that much?
Yeah.
I suppose we have to give them some grace. It's not their fault. So you can. But you are okay.
Yeah, I mean, I've recovered. It was a long time ago. It was like 4 or 5 years ago.
Yeah, 45. Oh, 4 or 5. I was like, whoa, you're looking good. Well, that's good to know. So yeah, I mean, would you have to possibly just give them some grace for that? Some of the other intimate health problems. Okay, so some of the most common conditions that we have are symptoms. Is itching, an itchy vagina. And if someone had come to you and said, okay, I have a constant itch, feels burning, what would you suggest is the first point of treatment or looking into that?
So I'd say go to your local sexual health clinic. They will probably ask you like a little sexual history. They will then probably do a little swab test just to check for any STIs.
Yeah.
But I mean, itchiness, it can be caused by a range of different things. But then if you say the word burning, that could mean, is it burning on urination? Could suggest a UTI.
Yeah.
Itchiness is also a symptom of thrush. So it could be, and itchiness can be like a sign of STIs.
Yeah.
And so it's important that you do, if it's something that's normal, that's not normal.
Normal for you.
Exactly.
Yeah. And with UTIs, like I have a friend who gets a UTI every single time she has intercourse. And then that obviously would suggest that there's, and like she gets treated each time as well, but obviously that's something that's, I think, needs to be a broader conversation. Like,
Yeah.
surely that shouldn't continue, or that happens every single time. Like, is that about the pH levels because of from having intercourse, or what is that?
No, so a UTI is due to, so women, they have a shorter urethra than men, so we are more likely to get a UTI. It's an infection of the tract of the urethra, and so this is usually caused by bacteria getting in to that tract. So it's usually caused by bacteria from our poo. Yeah, so it's, I love how
I need to go ring my friend.
So one of the things that we can do to prevent it is to make sure that when we're wiping in the bathroom, we always wipe from front to back. Exactly. Yeah.
So wiping back to front can give you a UTI?
Yeah. Yeah.
Wow. Like, don't rub front, back, front, back, front either. Just do front, back.
Yeah.
Keep it like that.
Yeah, exactly.
Oh, wow.
Don't keep wiping. Yeah, just
That's
one
why,
way.
because I have a daughter, and whenever you, like, I remember when she was born, the midwife saying to me, always wipe front to back. And obviously that's because you get bacteria from your poo into your vagina, and that is not ideal. So that's largely where UTIs come from, is that type of bacteria ends up inside your vagina.
Usually, and then also another way to prevent it is after intercourse, making sure you wee straight away.
Pray to Jesus, no more joking. What is it?
Wee straight after intercourse.
A pee, that's the thing.
Exactly.
Yes. So what is the problem? Is that to release any bacteria?
That's to clean the vagina. That's, it's to clean the urinary tract.
Yeah.
Yeah, so weeing straight after intercourse can reduce the chances of you getting a UTI. Yeah.
That is good to know.
Because having sex is one of the risk factors as well.
Yeah.
You know, different bacteria entering the urinary tract.
Yeah. Okay. We have a few questions here that we'd hopefully we can help someone out with. I'm dealing with reoccurring thrush, and it's starting to impact my daily life. Can you provide information on the common causes, prevention strategies, and effective treatments? I want to regain control over my intimate health and prevent these episodes from reoccurring. So suppose that's the same thing as like a reoccurring UTI, or anything that's reoccurring can be really debilitating to your life if it's something you're dealing with all the time. That can impact obviously your work life and your social life, and of course your sex life, which leads to like larger, bigger problems with your relationships as well. So this person's wanting to know, like, what are the prevention strategies with thrush? Like, how can we avoid getting thrush?
So, I mean, the cause of thrush can be a huge range of different things. It can be caused by antibiotics. So sometimes when we take broad spectrum antibiotics that can affect, you know, the bacteria at the levels of different things, and of bacteria in different parts of the body, that can be one of the things that causes thrush, because it upsets the balance of bacteria in the vaginal microbiome.
When you say broad spectrum antibiotics, what do you mean?
So I mean ones that just target lots of different areas.
Okay.
So, you know, the ones that many people might have had in the past,
the most common ones,
that kind of thing that a lot of people don't realise, even though they're just being used to treat like a chest infection, for example, they could also have an impact on your,
Wow.
And so stress can also contribute towards it. I know that smoking increases the prevalence.
Why can stress lead to thrush? Is that, I mean, I'm obsessed now with cortisol levels, and is it that, or is it just like the strain on your body? I don't know.
So I'm not exactly sure about the
mechanics.
The mechanics of it, but I know that stress can, I mean, it can weaken the immune system. It can cause like a huge range of, you know, adverse effects on the body, and it can encourage the growth of yeast, essentially, which causes thrush.
Okay. Yeah. Oh, that makes sense. Okay. So, here's one. Does my partner need to be treated for BV if I have it? So is this something that you can contract? Something that you can pass on? Because obviously if it's bacterial, like if you have sex with someone who has BV, do you know if that's something that they should then watch out for?
Yes, so I know that if you do have a partner,
I suppose a broad stance of that would be if you are sexually active with someone who has a bacterial infection of some sort. That
so obviously I mean, it's bacterial vaginosis.
Yeah.
So if you're a same-sex couple, then yes, you can pass on bacterial vaginosis.
Yeah. Oh yes, you can't get bacterial vaginosis. It's not bacterial penisosis.
Exactly. Yeah.
That makes sense.
It threw me off when you said if you can pass on.
Oh yeah.
Because I was thinking about my partner.
Yeah. Well, yes, this obviously is female partner. Yeah.
So if it's same sex.
Although the guys would probably try and make it bacterial penisosis, so they have it too.
I love that word, penisosis.
Penisosis. Oh, they'll try and have it. They'll try and make it. So here's another question. Why is discharge and smell of discharge a key indicator of general health? So can you tell from your discharge if you have other underlying issues in your body? Like, would that be a result of other health conditions?
I think mainly your discharge can tell you about if you have like an intimate health condition or a sexual health condition. So a lot of STIs, for example, present with a change in your discharge, and they usually are accompanied by other things like pelvic pain or, sores or warts, that kind of thing.
Yeah.
So I guess I don't know if it can tell you about, how your mental health is.
I don't think so.
If your chest is like clear.
It looks angry.
But obviously, as we were talking about before, it can tell you about your menstrual cycle.
Yeah.
And the discharge changes in accordance with your hormone levels.
And we'd spoken about how, a lot of men haven't seen discharge and they're not as comfortable with it as we might be, because we see it 10 times a day, or it depends how often you go. If you go towards 10 times a day, it might be a little much. You might need to visit your GP. Yeah, but as many times as you see it. And what I'm always intrigued about is so you did Love Island. And when you're in such close quarters all the time, that feels like everyone sleeps in the same room. Is that right?
Yes, yeah.
And I'm sure there's just bikinis and underwear and stuff lying everywhere with so many people changing all the time. And I'm sure there would have been a few raised eyebrows in that room from the guys.
Yeah, I guess. When we're changing, we have our own separate areas, so it's just girls only.
Yeah.
But when we're sleeping, we are sleeping all in the same room, and you do get to know each other quite well.
I would imagine so. Yeah.
And you especially what happens underneath the bed sheets, that kind of stuff.
Yeah. Because you spoke about people obviously are having sex in the room when other people are nearby.
Yeah, there is protection.
Yeah.
And so
available.
Contraceptive methods available. There are condoms everywhere. So
when you say everywhere?
Well, it was just that one day, but
one day there were condoms everywhere?
When it happened.
Okay.
There was one big day where on my season where I think three couples christened the bedroom at the same evening. But at least they were safe.
Exactly. Yeah. I suppose it's they're all consenting adults and they're all being safe. So,
happy days.
So why not? When you're living in such close quarters like that with other women, this is something I always wanted to know if it's true or not. Do women's periods sync up? Is that like a prehistoric idea? Because I remember living in university in halls with lots of other women, and the guys would be like, are your periods syncing up? Because maybe we were all annoyed at them at the one time and they would say things like that, and I'd be like, maybe is there any truth in that? Do you know?
That's a really good question. And
you've heard of that though?
Yeah, I have heard of that. It must, it's due to the hormone levels.
So you wonder if that can be
even possible.
Do you know what I mean?
Yeah.
Are we as connected to the moon as we used to be?
Yeah, I feel like maybe we should Google that.
We should Google that one.
Should we Google that one?
So there's their periods don't sync up. Why do people say that then?
I think it's one of those myths.
Isn't it?
Yeah, there's no scientific evidence to prove that different women that live together
sync up.
No, I think it's just,
I don't know why I want that to happen. I'm like, why? But it's like the idea of the Spice Girls on tour and everyone.
Yeah, I guess if you're talking about your period and you're like, oh well, I'm on my period, and someone else will jump in and say, oh yeah, I'm on my period too, and then it's natural for us to think that we've synced.
But it's not. That's not the case. No. So we've talked about cottage cheese, like discharge, and that is that's thrush and not BV. It burns when I pee. What's happening? So when you pee, when you urinate, I think, did you mention that was
one of the signs of a UTI?
Yeah. And are there different types of UTIs, or is it just like a general? Is that a blanket term?
So yeah, UTI is an umbrella term. Obviously, they can become more severe. Where, imagine an infection, it's starting in the urinary tract and it's travelling upwards, so it can eventually get to the kidneys.
Oh yeah.
So don't ignore your symptoms.
Yeah.
Always, seek help from your doctors. UTIs are really easy to treat. You can just get a short course of antibiotics, 3 days, and that will stop the infection from progressing.
Yeah.
But if it does get, sometimes doctors, they prescribe a delayed prescription, so you wait 48 hours to see if your symptoms go away, because sometimes it can just be like an
It can pass.
Exactly, it can pass, exactly. A lot of people, there's this myth as well about cranberry juice. I don't know if you've heard much about that. Yeah.
My mum used to drink it with her vodka at the weekend. She used to be like, at least I'm putting something good into my system when she's having a wee drink.
So cranberry juice has no effect on treating UTIs. So if you've already got a UTI, it's not going to help treat it.
Yeah.
However, there is some evidence that it can help prevent them.
Yeah, is it, hold on, is it the B vitamins? Am I making stuff up? What's in it? What's in the cranberry?
I think it's to do with
antioxidants, is it the antioxidants?
So cranberries do have antioxidants. I'm not exactly sure what they've got in them.
Yeah,
but
they can help. So do you advise then trying to drink a little cranberry juice on a regular basis, or just like having a very diet?
I don't think it makes that much of a difference.
Yeah.
There are other things that you can do, like stopping smoking, for example, to prevent UTIs, and
that's so
wiping front to back, that kind of thing.
Never would have connected smoking with a UTI. So that's brand new information for me. Okay, a question we have here is, hiya, I've been with my boyfriend for 3 months now. We met online, classic 2024, and I've been speaking ever since, and we've been on countless dates. However, we haven't done the deed. Recently, I have started to notice an unusual smell from down below, and sometimes my discharge is even a weird colour, and I'm so embarrassed to speak to this fella about it, and I don't know what it means. I don't know if it means that we don't clean properly or I have something wrong with me. Please help. That's tough too. If you're getting into a new relationship and you haven't had sex yet, obviously the first time you have sex with a new partner is already an absolute, it's usually not the rom-com thing that we see. It's usually that sort of, you don't know each other's bodies yet, you don't know what each other, you haven't synced yet sexually, so it is like usually quite awkward. Maybe I'm the only person. It's usually quite awkward, I think, the first time. So to go into that situation where you have something that you feel really embarrassed about, like how to navigate that's quite tricky, isn't it?
It is. I guess you just have to communicate with your partner when it comes to that. And you also have to know, is it just discharge that's changed? Do you have any other symptoms? Do you have any pain in your pelvis? Do you notice any spots? Is there any itchiness or soreness? And what colour is the discharge? That's really important. Is it green, yellow, frothy? That can be a sign of something else called trish. I can never say it, but trish for short.
Okay.
Trichomoniasis, I think is the full name. It's an STI.
I think what I've learned recently too is, and something I've never done as a woman, is how important it is to track everything that's happening with your body.
Yeah.
Because we have so many things that happen in our bodies. It's so complex and it's ever changing and ever evolving, and we age, and with that our what's normal in our bodies changes, and knowing what's normal for your body to be able to register when something's changed, that then you might need to seek medical attention, or maybe you could buy a product that might help you there and then, is so important. And I have never been in tune with my body really that much to keep track, and it's something I think I'm going to vow to do now, is to keep track of my menstrual cycle, keep track of what my discharge is like, check myself, do all those things that I think I have, and most women don't do. And why do we not do that? Why do we not? Like most women
Yeah.
don't keep track of all of the things that we should, especially with our menstrual cycle.
I guess it's still one of those taboo topics, just, you
Yeah.
know, women's health in general, talking about your vagina and what comes out of it.
Yeah.
And as we were saying, the word discharge, like,
Yeah.
you don't really go throw that word around left, right and centre
No.
with your friends, do you? It's still...
I tell you what, Priya, I will now.
yeah.
I'll be doing it now on the way home.
That first woman you see.
Yeah, I'm going to get arrested
What
on the way.
colour is your discharge?
Yeah, I'll be in the airport later, but like, let's, anybody want to have a chat about discharge? I've learned some stuff. But obviously it is so important now that we track all these things, and there's so many apps available to make it easier as well, where you can track your menstrual cycle. And like I downloaded one this morning, there's loads of them. And I've never done that before, where you can like put in how you're feeling as well, both mentally and physically, and it can help you monitor that, so that maybe like in the next month that you can go, okay, that was normal of me last month, or also you can track things like your discharge or your symptoms, and then you'll be able to figure out what your body is all about and what's different for your body. And it's a lot of work being a woman, isn't it?
Oh, honestly,
So
much
much.
work. So much work.
It's so much. It's
just existing.
Yeah, we're doing
tough.
so well. Aren't we just? Is there any other of these topics? So obviously with thrush as well, how we can treat thrush. Balance Active have as an applicator. There's a thrush cream, and what other products should we mention that are the BV symptom tracker on the website, and obviously the treatment gel and the pessaries. So there's obviously lots of stuff, and there's other places that you can go to get treatment for any of these.
Your
intimate health
GP
conditions.
can always give you a prescription for
Yeah, of
something.
course.
If you know the over-the-counter stuff doesn't work, there are antifungals for thrush that you can get. So yeah,
it's supposed
there's
just
a
like
treatment.
I think the first buyer is like admitting that there's maybe something there that you should get looked at, and then like try not to be embarrassed about the fact that you have a vagina that needs a bit of help.
Exactly.
Do you know what I mean? Because if your lips were dry, you'd put some cream on them. Do you know what I mean?
Bit of lip balm.
Moisturise your face.
Yeah.
Let's figure out our vaginas. Where can people find you online, Priya, if they want to find out a little bit more about what you do?
So at Priya Gopaldis on Instagram. And
Yeah, I'm at Diona and Comedy. Thank you so much for listening to the V Revolution podcast. We hope you've learned something today. And again, if you have any concerns, please do visit your GP. And yeah, up the vaginas.
Yeah, up the vaginas.